Right now, while you are reading this, your brain is lying to you about pain. Not some of the time. Every single time. Everything you think you know about why things hurt, where pain comes from, what it means, most of it is wrong. And that gap between what you believe and what is actually happening inside your skull, that gap is costing you. It might be keeping you stuck in pain longer than you need to be. It might be making pain worse. And it is almost certainly making you afraid of something you do not need to be afraid of. So let's fix that. Here is the first thing you need to understand. Pain does not come from your body. Pain comes from your brain. I know, that sounds wrong. When you stub your toe hurts. When you burn your hand hurts. The pain is right there. You can point to it. But what you are pointing to is a location, not a source. Here is what actually happens. The second you damage tissue, your body sends an alarm signal up through your nervous system. That signal travels to your brain. And then your brain makes a decision. It decides whether or not to generate pain. Your brain is the one pulling the trigger, not your body. This is not philosophy. This is neuroscience. Pain is an output of your brain, not an input from your body. And once you really understand that, everything changes. Here is the proof. Soldiers in combat report getting shot and feeling nothing. Not because they are tough. Because their brain decided, in that moment, that pain would get in the way of survival. So it switched it off. Same damage. Zero pain. Meanwhile, someone else gets a paper cut and it ruins their entire afternoon. Same level of tissue damage would barely register on a scale. But the brain decided it mattered. Your brain is constantly running a threat assessment. Every second of every day, it is asking one question. Is this dangerous? And the answer to that question determines how much pain you feel. Not the damage. The perceived threat. Let that sit for a second. Your pain is real. Nobody is saying it is in your head in a dismissive way. It is absolutely real. But it is being manufactured by your brain based on information that is sometimes wrong. Based on fear. Based on past experience. Based on what you believe about your body. And that means pain can be influenced. Pain can be changed. Not by ignoring it. Not by being tougher. But by understanding what your brain is actually responding to. Here is where it gets darker.
Chronic pain. The kind that never goes away. The kind that has been there for months or years. That is a completely different beast. And most people have no idea what is really driving it. When you experience pain repeatedly, your nervous system learns. It adapts. It gets better at producing pain. The pathways in your brain that generate pain signals become more sensitive, more efficient. Your brain gets so good at creating pain that it starts doing it without much input from your body at all. Scientists call this central sensitization. Your brain is not overreacting. It has been trained. It has practiced producing pain so many times that it now does it automatically. Like a habit. A terrible, exhausting, involuntary habit. This is why people with chronic pain often have pain that moves. Pain that appears in new places. Pain that does not match any visible injury. Their doctors run every test and find nothing. And the person feels crazy. Feels like nobody believes them. But the pain is real. It is just coming from an overly sensitive, overtrained nervous system. Not from ongoing damage. Your body might have healed completely. And your brain is still sounding the alarm. Now here is the part that changes things. Your brain updates. It can unlearn what it learned. Scientists call it neuroplasticity. The same way your brain learned to amplify pain, it can learn to quiet it down. But only if you give it the right information. And the most powerful information you can give your brain is safety. When your brain believes you are safe, pain decreases. This is not wishful thinking. This is measurable, documented, reproducible in a lab. Studies show that simply understanding the neuroscience of pain, just learning what you are learning right now, reduces pain levels in people with chronic conditions. Not medication, not surgery, education, understanding. Because when your brain understands that the alarm is false, it starts turning the volume down. Think about a car alarm going off in a parking lot. The first time you hear it, you pay attention. Could be a real threat. But if it goes off every single day for no reason, you start ignoring it. Your brain does the same thing when it understands that a pain signal is not connected to real danger. But most people do the opposite. They hear the alarm and they panic. They Google their symptoms at 2 a.m. They catastrophize. They tell themselves something is seriously wrong. And every time they do that, they are handing their brain more evidence that the threat is real. And the brain cranks the pain up higher. This is the pain catastrophizing cycle. It is one of the strongest predictors of chronic pain. Stronger than the original injury. Stronger than age. Stronger than almost any physical variable. What you believe about your pain shapes how much pain you feel.
Fear makes pain worse. Always. So what do you actually do with this? First, stop treating pain as a sign of damage. Start treating it as a signal worth investigating. Ask yourself honestly, is there actual tissue damage happening right now? Or has my brain just been on high alert for so long that it keeps pulling the trigger out of habit? Second, move. One of the most counterintuitive things about chronic pain is that avoiding movement makes it worse. When you stop moving to protect a painful area, your brain gets more afraid of that area. It increases its threat response. Movement, gentle and gradual, tells your brain that the area is safe, that you are okay, and that information is medicine. Third, understand that stress feeds pain directly. Cortisol, the stress hormone, amplifies pain signals. When you are anxious, your nervous system is already running hot. Everything hurts more. This is not weakness. This is chemistry. Reduce the stress load and the pain load drops with it. Fourth, stop hunting for the thing that is wrong with your body. Stop looking for structural explanations for every symptom. Sometimes there is nothing to find. Sometimes the issue is in the sensitivity of the system, not the structure of the tissue. Chasing a physical cause for a sensitization problem is like replacing the engine when it is the alarm sensor that is broken. Here is what I want you to take from this. Pain is not punishment. It is not a life sentence. It is not proof that you are broken or weak or that something is fundamentally wrong with you. It is your brain trying to protect you, doing its job, sometimes doing its job too well. And once you understand that, you stop being a victim of it. You start having a relationship with it. You start asking better questions. You start giving your brain better information. The people who recover from chronic pain fastest are not the ones who find the perfect treatment. They are the ones who change their relationship with pain, who stop fearing it, who understand it, who work with their nervous system instead of fighting it. Your brain built this. Your brain can rebuild it. That is not a motivational poster. That is neuroscience. You have been living inside a system you did not understand. Now you understand it a little better. And that knowledge is not nothing. That knowledge is the beginning of something shifting. Pain got your attention. Now use that attention wisely.